Hi, it's Dr. Markou with Tampa Bay Hair Restoration. So the discussion today on this video is going to be on FUT versus FUE. That's follicular unit transplant, which is referred to as the strip, versus follicular unit excision, or FUE. So the reason why I've had an influx of so many patients who've been to consultations where they were told they're good candidates for this new FUE. And some are, but too many of them are really not the best candidates. So what would make you a good candidate versus a bad candidate? To be a good FUE candidate, you should have a lot of healthy hair in the donor area, a large area of healthy hair, a large area of non-thinning healthy hair. Some influx of these patients are coming in who are thinning way down and just have enough area to take a couple of strips. And they're being told to do FUE. Well, if you take hair from those areas that are weak or not meant to grow for a long time, they'll only grow in the transplanted area as long as they would have grown where they came from. So I would not recommend FUE to those patients. Now, patients who have a nice, healthy head of hair in the back that want to avoid a linear scar so they can wear their hair at any style, I strongly recommend doing an FUE. At my clinic, we have the robot, and that is the most advanced instrument to perform FUE with. So going back to FUT, follicular unit transplant, meaning the strip, it's kind of a terrible way to talk about it because they're both follicular unit transplants, but FUT refers to the strip. Going back to that, it still is our gold standard. We still get the same good result in a good candidate as we would in a good candidate who's a good FUE candidate or robot candidate. So I'll tell patients sometimes, hey, it's up to you. You have beautiful hair in the back. I can give you the same good result whether you go with a robot versus a strip. Or sometimes I'll tell them, I know you want to do a robot because you don't want a linear scar. However, I don't think you'll get the same result. So make sure when you go in a consultation that you're meeting with the doctor who does the procedure. Make sure that the techs who help him with the procedure are his techs. Don't go for the flying in and flying out of techs routine, because that may be a situation where the doctor is not very well trained or hasn't been doing it long. And it's certainly not the best situation where techs are coming from different clinics. So, make sure that the clinic has been there for a while. Doctor's got good experience, many, many years. So in any case, always ask questions. So give us a call if you have any questions. Otherwise, I look forward to hearing from you and seeing you soon. Have a great day.